Rhinoplasty is what we're going to be talking about in this video. A lot of things happen in a rhinoplasty, but for the sake of simplification, these are essentially divided into 5 simple steps. So whatever one may want in a rhinoplasty, whether it's a female rhinoplasty or a male rhinoplasty, the corrective procedures are these 5 basic things which I'm going to be talking about. Now, if you look at the mannequin, the most commonly done procedures are: number 1, concerning the bridge of the nose. One may want the bridge to be elevated, or one may also want the bridge to be reduced, which is called the hump nose. So the bridge elevation is usually done by using a foreign material like silicone, or it can also be done using the patient's own material in the form of a cartilage taken from the back of the ear, the nose, or elsewhere from the body. The commonly used foreign material for augmenting the nose or improving the nose is silicone. Now, the second most preferred thing for patients could be to reduce the hump of the nose. So if you look at the side views, you may have seen, especially it's a very common problem in the north, or also people from Persian and Turkish descent, they have a humpy nose. So this can actually be taken down. That comes in the dorsum. If you look at the width of the nose can be reduced in the upper 2/3 by breaking the bones and getting them closer. That narrows the nose. That's procedure number 2. Procedure number 3, the lower 1/3 of the nose, that can be narrowed as well. That's called the alar base reduction. Patients can also prefer to have their tips refined. Now, when you talk of tip refinement, they have bulbous noses. This can be kind of reduced and made to match the rest of the nose, and thereby giving a sharper feature to the nose. So that's the tip plasty, which is procedure number 4. The tip can also be elevated or rotated up, thereby giving more projection. So all this comes under tip plasties. So these are procedure number 4. Now, if you look at the basal view, you have the columella, which separates the exterior of the nose into 2 halves, 2 nostrils. At the same time, you have the septum, which is inside, running inside, and separates the nose into 2 halves. There might be a functional problem because of the deviated nasal septum, which may have to be corrected, and this is called as a functional septorhinoplasty, where the patients benefit by getting the rhinoplasty done and thereby having no breathing problems after the procedure. So these are the commonly done procedures in a rhinoplasty. In any rhinoplasty, the essential steps are these 5, and it's mandatory for you to know and understand what can be done and what can be done. How is a rhinoplasty done? What are the approaches to a rhinoplasty? Essentially, there are 2 approaches to a rhinoplasty. One is the external approach, where an incision is made on the lower part of the columella, and once this incision is made, the envelope, the skin envelope, is lifted like a curtain, and the structures are exposed, and whatever the plastic surgeon wishes to do with the tip, modifying the dorsum or doing even the width of the nose to be reduced, whatever the plastic surgeon plans, can actually be done with the external approach. It's the most preferred approach by plastic surgeons because everything is visible to us, and we can modify it to the likes of the patient. But there are some patients who may not want a scar, or who may want to get only minimalistic corrections of the dorsum of the nose. In such a case, you can also use the internal approach, where the incision is made within the nostrils and which is not seen to the exterior, and the job is done, whether it is modification of the dorsum or whether it is kind of widening the width of the nose. That can also be done by an internal approach. So it varies from patients to patients, it varies from the deformity which a patient has, but by and large, external rhinoplasty is the one which is preferred by most plastic surgeons, for the simple reason that majority of the problems can be addressed by the external approach. As plastic surgeons, we get asked from our patients, what is the material used in a rhinoplasty? Now, depending on the need, there can be many types of material going into the nose. The commonly used material is what is available within the patient. And if you see, when we open the nose, you have the septum inside, which is nothing but a cartilage. So septum cartilage is commonly preferred material if you have to modify the tip, or if you want to elongate the columella. So that is material number 1, which is readily available. Okay, once this is not adequate, we also may use the ear cartilage, which is called the conchal cartilages. It's taken by giving a very inconspicuous incision at the back of the ear, and this is not visible, and we take the material either from one side or from both the sides, depending again on the deformity which is present and what is the extent of correction which is required for the patient. So this is material number 2. Material number 3 could also be from the rib. So there are patients who may have a severe saddle deformity where there's so much of depression of the nose that you require lots of material. So in such a case, when you require more material, you might have to harvest the costal cartilage and use this costal cartilage for augmenting the nose, and not only augmenting the nose but also to give a structural support to the tip. So when a lot of material is required, we use the costal cartilage. Now, in the previous decades, there were instances where plastic surgeons used to use the bone, but these days it's very, very uncommonly used, as it's not really mimicking the nose. So the first few which I actually mentioned are the most commonly preferred material. However, some plastic surgeons might even prefer material which is not available within the body, which is available ready-made outside in the market, and this is nothing but the silicone implants. See, the advantage of the silicone implants is they are ready-made, they come pre-shaped, they come pre-carved, and it's not required to cut open some other area of the body to harvest. It saves the time, and at the same time there is no scarring, there is lesser pain, and the operation gets over in very, very quick time. So silicone cartilages is often preferred by plastic surgeons when they have to actually do the augmentation of the dorsum of the nose. Recovery after rhinoplasty, however complex or simple it might be, it's pretty standard. Now, even before we take the patients for a rhinoplasty, we tell them what to expect. Now, as soon as the operation is done, we pack the nostrils for the simple reason we don't want bleeding to be an issue. So the nostrils, they act as a hemostatic plug where they stop the bleeding. And after recovery, once the patient gets back to his consciousness or her consciousness, we don't want the patient to actually start to feel suffocated, and we tell them that there is a nasal pack which is put in the nostrils and that they should open their mouths to breathe. So this would calm them down and help the doctors attending onto them to safely get them out of anesthesia. Now, as soon as the surgery is done, the patient would have a protective external nasal splint which is actually left in place for almost a week's time. Patient is put on antibiotics, patient is given painkillers, and sometimes we also ask them to ice the area, because after doing extensive osteotomies on the face, there could be sufficient swelling around the eyes. So this can actually be reduced by making the patients lie flat or icing that particular area, helping the swelling to settle down as quickly as possible. Sutures are usually removed after the 5th to 7th day. The splint, which is actually on the nose, is removed usually on the 7th day. The instructions which are given to the patient once the patient is discharged from the hospital are not to bend forwards, because that can cause a lot of congestion and thereby can cause some amount of bleeding, which is what we don't want our patients to do. And when they are actually sneezing, we expect them to open their mouths and sneeze, because if they sneeze with the mouth closed, all the gush of air can actually ruin the work which we do for the delicate nose work. So this is something which we tell our patients, and no straining whatsoever. We don't want the strain and the other thing to actually impact the work of our surgery. And so these are the basic instructions. Generally, by the end of 1 to 2 weeks, 60 to 70% of the swelling comes down. Usually it takes around 4 to 6 weeks for around 80 to 90% of the swelling to come down. In a few cases, even up to 3 months, we have to wait for seeing some amount of last final stages of swelling to come down, and thereby seeing the final result. Liquid rhinoplasty is becoming the fad word. It's catching up in trend. The simple reason, it's non-surgical. You may not have to go through the downtime. It's quickly done as a lunch hour procedure. There's no recovery and no swelling, and you don't have to go through anesthesia. There's no cutting open. That's the reason why liquid rhinoplasty is becoming more and more popular. Now, what can you do in a liquid rhinoplasty? First and foremost is a patient who has a depressed nose, that can be corrected, that can be elevated. So in a liquid rhinoplasty, what is done is actually to inject hyaluronic acid in small quantities wherever you need correction. So dorsum of the nose, where you want an elevation. That's one particular indication for a liquid rhinoplasty. Sometimes it can also be used after rhinoplasty, after a major rhinoplasty, and if the patient has some amount of irregularities, a little bit of hyaluronic acid can be injected just to even out and give a very, very smooth result. Now, the liquid rhinoplasty has also been extrapolated to doing the tip, especially when you want a tip rotation. You can inject some amount of filler in the inner aspect of the septum, causing the tip to rotate. So that's another indication where you may have to do a liquid rhinoplasty, and where patients are very finicky about surgery and they don't want to have any downtime. They're very scared of surgeries, and this is something which can be very handy for them, and they can avoid a major surgery. If the patients have these indications, liquid rhinoplasty can be very, very helpful.